Hi, everyone. We're going to give it about 10 seconds just to let folks in the room for today's webinar. Chris, let me know when everybody's in. But thanks for everybody for joining us today. We are recording today's webinar about WIC, diving into some basic information about the program. So we'll give it just a few more seconds to let everybody into today's webinar.
Hi, Signe and Chris. I just wanted to say hi. It's Aisling with the Daily Memphian.
Hello.
I wanted to jump on the Zoom today and do a story about the fact that, you know, so few people who are eligible for WIC are actually getting it and what can be done to increase those numbers. So
great. Welcome to today's call. We're happy to have you here. And we're going to share some of the basics. We'll talk a little bit about some of the barriers that people run into, but we wanted to share some basic information across the board, and we can always follow up with you afterwards too.
Okay, that sounds great. Thank you. I just
welcome.
I don't like when a reporter gets on a call and doesn't let people know they're there. So
thanks for letting us know you're there.
Absolutely wanted to be clear that I'm doing a story. So, but yeah, I'll follow up with you all if I have some questions afterwards.
Sounds good.
Thank you.
All right. Chris, are we good to go? All right, excellent. I think everyone's in. I'm sure we will have a few people join as we go, but I want to kick us off because we have a couple of great presenters today, and I want to save space for everybody to talk about their experience with WIC, and hopefully at the end we will save some time for questions. But in the meantime, if folks would just mute their lines until the end of the call. If you do have questions, please put it in the chat box. But welcome to today's call on WIC, Food for Families in Tennessee. I'm going to get us started just by doing some introductions of the TJC staff, and I will, there we go, TJC, the nutrition team. I am Signe Anderson, the Senior Director of Nutrition Advocacy. You will also see Chris Riles on the line. They're our anti-hunger advocate, and we'll be manning the chat and keeping an eye on today's conversation. And Anna as well is online. Anna Luttrell is the nutrition client advocate. And the next slide has all of our fearless TJC nutrition interns who are here with us for the summer. Alicia Pruitt, she helped us put together today's presentation. So I want to shout out Alicia, and our other interns may or may not be on the line today, but they've all been helping us with our programs. And before we get started, I wanted to give you a little bit of an overview of the agenda, I think is our next slide. Today's agenda is right here. I'm going to give you a quick overview of TJC and our anti-hunger advocacy, just for those who might be new to us. And before we dive into information about WIC, I wanted to talk a little bit about poverty and hunger in Tennessee and the data that shows where we are. This is the area that we on the nutrition team at TJC work closely. And then I'm going to introduce our guest speaker today, who will share more details about WIC. You'll hear from the Knox County WIC folks, and then you'll hear from one of our community partners. Then we'll talk a little bit about a statewide project that we're working on, and looking forward to hopefully bring others into this work through that project. And then we always like to leave with things that folks can do, because we all work with similar networks of individuals. And so this is a very important program that a lot of people that we work with on SNAP and in other areas of our work on TennCare could be connected to the WIC program. So we like to connect those dots, and we'll talk a little bit about that at the end. But first, let me start by just sharing a real brief overview of TJC and what we do. All right, as you know, and as I mentioned, we are the TJC nutrition team, and our focus is addressing anti-hunger issues and doing advocacy around the nutrition safety net programs. We are eager to see that people who are eligible for SNAP, WIC, and the child nutrition programs have access to those programs, and that they operate in a way that are effective and serve the people who need them the most in our state. And some of what we do is really looking closely at these programs to figure out where some of the barriers are, to try to remove those barriers, and then also lifting up best practices where things are working really well. We advocate for solutions to those barriers and the systemic issues that sometimes exist with government programs. We do a lot to share information, like today's webinar. This is something we do every month for the various different programs that we work on. And we'll come out into the community. So you may see us out and about, making sure that people know about the programs and why they're so important, not just to the individual who might be eligible for the program, but as a greater community, why it's so important for people to be connected to the nutrition assistance programs. And then we provide policy expertise and do direct client casework. I introduced you to Anna earlier. She leads our casework team, and our individual casework really helps to inform the advocacy that we do. And Chris, you can turn it to the next slide, please. As I mentioned, the federal nutrition programs are really what we focus on the nutrition team side. Many of you are probably also familiar with the work that we do at TJC on healthcare and advocacy around better access to healthcare across Tennessee. But we're very much so focused on the nutrition assistance programs, working closely on SNAP, on WIC, on the National School Lunch Program, on school breakfast, on the Summer Food Service Program, and the Child and Adult Care Food Program. These are all areas that we focus on. You can turn it to the next slide. And as I mentioned, like we are very focused on addressing poverty and hunger across the state, and we believe that the Nutrition Safety Net program is an excellent way to address this. We think it's important, though, to take a look at the numbers and understand where we are and set goals for making sure that our numbers improve. And so on the poverty side, 13.9% of Tennesseans live below the poverty line. 18.8% are children, 16.9% are women. And just to give you a sense of what 130% of the poverty line is, and that's to be eligible for SNAP, it's $39,000 for a family of four. So if you bump up a little bit above that, then you're not eligible for SNAP. You might be eligible for WIC. So we're very excited to be talking about WIC today. And also, when you look at the poverty numbers in Tennessee, children and women are significantly affected. And so again, this is another program that is great to help alleviate poverty and hunger in our state. And Chris, you can go to the next slide. And just again, just to talk about how poverty creates barriers, and what families experience when they are impacted by poverty. Some of the top things that happen are food insecurity, struggling to buy enough food or healthy food. Families who are struggling with the poverty line are often limited to healthcare. Childcare costs are a challenge. Housing insecurity, transportation, and being able to make ends meet are all things that people experience when they are impacted by poverty. And a reason why we think it's important to connect with partners across the state who who work in these various areas, because I think united we can do a lot to connect programs to people that we all serve. And again, the highest rates of poverty often impact women, children, young families, Black, Hispanic, Indigenous people, and individuals with disabilities. So I wanted to put that front and center for people before we dive into information about the WIC program. And Chris, you can go to the next slide, please. And just a little bit more focusing on child hunger. During the pandemic, families with children, understandably, were hit hardest when it comes to food insecurity and hunger. Many children did not go to school. Parents had to stay home. Many parents had to quit jobs in order to take care of children. So food security during the pandemic increased to 31% for individuals with children in Tennessee. And the burden was highest for Hispanic, Black individuals with children. And you can see the breakdown there. That was a significant increase. It was already, food insecurity was already something that impacted Black and Latino families more than their white peers. And so I think it's important to take a look at this as well and understand the situation of poverty and how it affects different groups. Chris, you can go to the next slide. And hunger for Tennessee women is also a significant issue. 11.2% of Tennessee women are food insecure. Tennessee ranks 43 in the health of women and ranks 35th in the health of children. And 35 out of 95 counties in Tennessee are considered maternity care deserts. So I present these data points not to show the negative side of food insecurity, but as an opportunity, because the nutrition safety net is a great way to address this. There is a solution. There is something we can do to address this. And that's why we're talking about the WIC program today. And Chris, you can go to the next slide. So the special supplemental nutrition program for women, infants, and children, known as WIC, has so many positive attributes to the program. It reduces food insecurity. It can alleviate poverty. It's not just a program that looks at the nutrition side of things. It's also addressing health disparities as well. It improves birth outcomes, improves health outcomes. It's also been shown to support long-term learning. When children are at their youngest, this is the key time to be addressing nutrition and health issues and making sure that pregnant moms and young children have the support they need in order to build that foundation of health and nutrition to set them up for long-term success. And WIC is one of those programs that does that. And in addition to just supporting the family, it also supports economic stability across the state, within the family. So there's a lot of really important pieces to the WIC program. And so we'll dive in a little bit more into that in today's presentation. And Chris, you can go to the next slide.
Yeah, we have a question in the chat first. Almetria Turner asks, I'm curious as to which 35 counties are maternity deserts. Where can I find this?
Sorry, Chris, will you repeat that question?
Yeah, Almetria Turner asks, I'm curious to know which 35 counties are maternity deserts and where can I find this?
I will send you the citation for that one to give you the details. We'll put that in the follow-up. And if I didn't say this in the beginning, we are sending today's recording along with the links and resources that we talk about today to the follow-up to this email or to today's presentation. So we will send that to you. We've noted your question and we'll send that information out. And all right, and then just a little specific WIC data. This is the national scope of the WIC program. one of the reasons why we're very focused on this is because WIC, with all of the positive pieces of the program, all the positive aspects and all the support that is there for women and children, the participation is much lower than it should be. And so this just gives you a sense. WIC as a program often does is able to capture infants. You can see here that 81.7% of infants participate in the program, but as children get older, they lose access to the program. And then also when you look at pregnant women versus postpartum women, oftentimes pregnant women don't know about the program, find out about it later in their pregnancy. And so there's a lot that we all can do to better connect families to the program. And so one of our goals as an organization is to try and connect some of these groups that are often missed. And this is just the breakdown of ages of participants that are missed. But as I pointed out in the COVID slide, the other area of missed population are our Black Tennessee families, our Latino families, immigrant families, and oftentimes individuals who do not speak English as their primary language. And so that's another area that we're looking at. But this gives you a nationwide snapshot of what participation looks like. And the next slide, we'll talk a little bit about Tennessee participation. All right, in Tennessee, 39% of infants born in Tennessee participate in WIC. On this slide, you'll see that 114,000 over 114,000 individuals are WIC participants, and this gives you the breakdown by category: pregnant women versus breastfeeding versus postpartum. Unfortunately, we're only reaching 37% of eligible families. Tennessee has done a lot during the pandemic to increase participation, but we still have more to do. So again, that's part of the reason why we're having today's conversation. The other thing that I want to point out as well is breastfeeding in WIC. It's a significant support to families, and often this is part of the information that I think is important to share, because I think some people who are outside of the WIC program don't realize that how supportive the breastfeeding side of it is, and connects a lot of moms to resources on how to be able to do that. So that's another important aspect of the WIC program. And then the next slide, I think we have just a little more data. Even though we're only reaching 37%, we did see a 2.5% increase in Tennessee in the WIC program during the pandemic. We hope that the increase in participation continues to go beyond the pandemic, and that's something that we're digging in on with partners across the state, and we'll talk a little bit more about that at the end. And then I think the last slide, I just wanted to give folks an idea of what some of the barriers are to the program, and I think that's our last slide before we hear from our guest speakers today.
We've got one more question in the chat. What is the best way for a Hispanic mom to reach out to the program? Does the program provide interpreters? Is there a direct phone number for Hispanic families?
Yes, so, and we'll provide this information as well. Each county has a county office that you can connect to for families to apply and get connected to the program. And there are translation services. This is a requirement. As a federal program, there has to be translation services. So keep that in mind. But one challenge to the program is, even though there are translation services, sometimes navigating an online phone system is not easy if you don't speak English. If you have to go through prompts that are in English to get to your language, it can take a little bit longer. Or I think the other piece to this is if there aren't translators available, sometimes it just takes longer to get through. And so I think this is a key area to work on when it comes to connecting families to these resources. So yes, there are language services, and I think there's always room for improvement in connecting non-English speaking families to programs such as WIC. The other piece that we find is there's just lack of information. I think there are a lot of people that don't realize that they're eligible. We've heard from people that we work with through the SNAP program, not know that if they're on SNAP, they're also eligible to participate in WIC. If you are pregnant, if you're postpartum, if you have children up to the age of 5 who are participating in the WIC program, you are income eligible for WIC. If you're participating in SNAP, you're income eligible for WIC. And then some of the structural barriers beyond the language barrier that we just talked about, transportation can be a barrier. During the pandemic, people were not going to WIC offices in person, and so the WIC program had to pivot and became very virtual focused, which is not how WIC has operated in the past. And coming out of the pandemic, there's been some more flexibility around that. Also, time away from work. Oftentimes WIC offices are open during business hours, and young moms often have to work. And so finding time away from work to enroll or stay enrolled can be a challenge. Anyone who's had a negative experience at the clinic or has had a negative experience in the grocery store trying to identify a WIC product can also deter people from participating in the program as well. So these are some things just to keep in mind, and some things that we are thinking about when how to better connect families to the program. And then, of course, finally, stigma associated with government programs. Again, we're trying to make people understand that having access to nutrition, this is something that we're all eligible to participate in, and trying to eliminate the stigma that exists around the programs. And so these are just a snapshot of some of those barriers. All right, and now we get to talk to today's presenters. First, you'll hear from Lori Emond from Knox County, the Knox County WIC office. She is the Knox County WIC director. She's going to give you an overview of the WIC program and share a little bit about what they do in Knox County. And we're very excited to have her on the line today and share her expertise. Lori, I'm going to turn it over to you.
All right. Thank you. Thank you so much. I will try to see if I can boil everything about WIC that I know. Gosh, I've worked there for 30 years, just about. So this 15-minute time slot's really hard for me, but let's see how it goes. So hi, everyone, and appreciate this invitation and, of course, this opportunity to share a little bit of what WIC is all about, and for you all as advocates for people who qualify and trying to plug them into accessing the program services. So let's get this rolling, shall we? Next slide. Thank you. My goals. I determined these to be my primary goals for this presentation. You guys can read those. WIC is a complicated government program, as government programs can be. So distilling the information down to the pertinent info that will be useful to you was top of mind as I prepared what I'll share with you today. So hopefully I will accomplish this overarching goal as we move forward. Next slide, please, Chris. So the premier public health nutrition program known as WIC started in the early 70s with bipartisan political support, which it still receives mostly to this day. WIC is regulated and administered by the USDA, along with other recognizable major programs listed here. Signe mentioned some of these as well in her lead up to this presentation. And at the time this was occurring, the concept of food as medicine, and therefore was connected to improved health outcomes, had been evolving. And from this, WIC was formed. Since the beginning, there have been many, many changes. but the core mission of WIC has remained steady: to safeguard the health of low-income women, infants, and children up to age 5 who are at nutrition risk by providing nutritious foods to supplement their diets, information on healthy eating and healthy habits, and referrals to healthcare. And that's it. That's WIC in a nutshell. Next slide, please. So WIC eligible clients include, as has already been mentioned, prenatal, postpartum breastfeeding and non-breastfeeding women, infants and children up to age 5. WIC is an income-based program, and I think Signe mentioned the income guidelines. An easy reference for a family of 4 for SNAP was 130% of the federal poverty limits. For WIC, it's considerably higher, 185%, and that puts a family of 4 can earn up to $55,000 a year gross income and still qualify for WIC. So many families, you're correct, they don't realize they're eligible, and WIC may in fact be one of the only assistance programs that they do qualify for. So there's lots of program lingo here that I'm not going to go too deeply into. To participate in Tennessee WIC, you must reside in Tennessee. And usually it's in the local county service area, although this is not a hard and fast rule. Also, citizenship is not a requirement. And yes, over the COVID timeframe, WIC enrollment across the state has steadily increased. Our participation gets measured every month. And so June was the last month that I have complete data for. So you can see that statewide, the participation is higher. Knox County participation measured here since the beginning of the pandemic, which I count as March 2020. We have literally gone higher than I ever imagined was possible. So pre-pandemic, we were at about 6,500, and at last count, we were up over 10,400. And the operating budget to do all that remained flat, although we do have a nice bump coming our way starting October 1, which is great. Next slide. So fundamentally, for all that's complicated about WIC, what WIC provides is pretty simple. A staple of what sets WIC apart from other food programs is the nutrition education component. Routine access to counseling with a qualified nutrition educator is key to the success of WIC, and it is a requirement that we provide nutrition education at those intervals. Of course, what we're known for is providing healthy foods more than anything. And then the final mandate of the WIC program is referrals to health and other community services. All WIC local agencies maintain an extensive list of applicable resources, which we are in fact required to provide for our clients. Next. So having mentioned the routine nutrition counseling, let's get just a little more specific about what that looks like. COVID may have changed how we do WIC business, but not the frequency of our interactions with clients. Initial enrollment on WIC is known to us as certification. It's a 2-part process that first involves eligibility determination. And this step is conducted by WIC staff other than the nutrition counselors. This separation of duties is one way that WIC maintains integrity and ensures the applicants first qualify on the basis of income and residency. From there, subsequent interactions are with nutrition staff at every interval until recertification. And for children, this is done approximately annually. For prenatals, we recertify after delivery. And at that point, the new baby is enrolled onto the program along with the rest of the family. And then this process repeats itself with part 1 and part 2 again, and so on. So statewide, WIC offices will most likely have different service operations. We have an old saying in Tennessee, when you've seen one WIC clinic, you've seen one WIC clinic. So you can't really transfer what you know about one location to feeling confident that that's what you're going to find at another location. In Knox, we have been and we will continue to offer remote services. And for us, that means by phone, if that's what clients prefer. But our door is also open all day, every day, and we offer a host of walk-in services as needed or desired. And you know, the remote option, yes, it did start because of COVID. COVID waivers taught everybody a lot about what could actually be done in the context of providing WIC services. And I'm very appreciative that the state of Tennessee is allowing us, by opting in to what the next phase of flexibilities are going to be, but only if you wanted to. And we're referring, those are the ARPA waivers. So ARPA waivers go into place in August, early August, literally overnight. The COVID waivers will end and the ARPA waivers will begin. And that is how I can say that in Knox, we will continue the remote visit option. As you already saw, it showed to be very, very useful for our clients to be able to access. It removed a great number of those barriers that were listed. And we know about those barriers. And so the remote option has been fabulous for them. Next slide, please. So once enrolled, each client receives a specified quantity of each of the foods that make up what is called a food package or a prescription. Only nutrition staff are permitted to prescribe foods. Nutrition staff are expected to issue the predetermined maximum quantity of each food item for each client, with few exceptions. Food benefits WIC provides for children and for women are listed here. For breastfeeding women, the quantity of food received depends on how much, if any, formula her baby is receiving. If the amount is 0, or no more than half the maximum quantity of formula that a baby can receive, then she herself can remain on WIC for the full first year and continue to receive food package benefits for herself. Otherwise, a postpartum woman who's not breastfeeding or a postpartum mama who's receiving more formula, she stops receiving her own food benefits at 6 months postpartum under current regulations. Infants who are partially or not breastfed at all receive infant formula. Our state contract is currently with Abbott to provide Similac products. Other products can be requested by a qualified healthcare provider and provided by WIC if the request meets program guidelines. At about 6 months of age, infants also begin receiving infant foods. Next slide. Ooh, back up one. There we go. In 2010, the WIC food package was updated to include fruits and vegetables. This was a fantastic upgrade. Initial dollar amounts for this benefit were considerably lower than what they are now. And this benefit, now known as a CVB, cash value benefit, received a significant bump upward during the pandemic to these levels listed here. Congress shows continued support for these higher but still temporary CVB amounts. Clients express high satisfaction with their CVB benefits. And the CVB has a key feature. It is very flexible. Clients can choose what they and their children prefer. Unlike other somewhat restrictive food items provided by WIC, the flexibility for preference makes the CVB easier to align with cultural food practices among the diverse populations served by WIC. For a multitude of reasons, we hope the CVB levels remain high, but it is up to Congress, so pay attention and we shall see. Next slide, please. So in Tennessee, EWIC cards replaced paper vouchers, which was a happy day, very happy day. USDA had mandated that all state WIC agencies make this transition to EWIC cards no later than 2020. We beat that deadline, which was nice. After extensive preliminary planning, Tennessee began our rollout in 2018 and completed it statewide in 2019, which really began a new era for Tennessee WIC as we made the change to an electronic record system at the same time. It was crazy, but you know, it couldn't have happened at a better time. Because these timely changes allowed Tennessee WIC to be resilient when the pandemic emerged. Throughout the pandemic, WIC flexibilities were made possible and also successful due in large part to our electronic system. Key state administrators who had also had the wisdom to select the magnetic stripe card option rather than the chip card, as mag stripe allows remote food package changes and the chip card does not. Had it not been for that single decision there all those years ago, everything would have been different for what we were able to do for people. It would have been a completely different ballgame. But every change does have growing pains. And while many clients express increased satisfaction with the shopping process, once we had made this transition, we remain mindful of the clients who do continue to struggle for various reasons. Next slide, please. So when discussing anything in WIC that's related to foods and shopping for foods, it is important to remember that this part, shopping, can be hard. Families are on their own. When clients are inside the WIC office, we are in control of following complicated rules and regulations, but we're there. We're there with them. Outside the office, when navigating the WIC shopping process, clients are largely operating independently, and it can be confusing and overwhelming. This benefit printout, for example, shows some important things. The family's benefit cycle dates. As you can see, they don't start at the beginning of a month. And foods prescribed for the family members. And it shows the total amounts of each food for each cycle. But inside of this, there's details. So this family of 4 receives everything you see here. And typically we do issue 3 months of benefits at a time, reflecting back on quarterly visits. That kind of makes sense, right? So if you see us at the beginning of a year and we see you again quarterly, we do 3 months of benefits until we meet again, et cetera, et cetera. But some things listed here are easily navigated. The CVB amount, for example, $94. I can chip away at that until it goes to 0. And that's easy to see the beginning and at the end. The cans of formula, they know what to get. You get 9 of them on this example, and that's easy. But other things are harder. For example, cereal is listed as the total number of ounces that the family can get. But the minimum box size is 9 ounces. The maximum is 36 ounces. And when was the last time you were in the cereal aisle looking at the box sizes of cereals? Because the box sizes are anything but standard. Other items have similar sticky wickets that can make shopping for WIC a challenge. For some clients, more so than others. Next slide, please. So what's in place to help with the challenge of achieving success when shopping for WIC? For starters, each client does receive the Tennessee WIC shopping guide that describes in detail their choices of brands and types of food allowed within each food category. While we cannot control the language options at the grocery stores, we offer the shopping guide in English, Spanish, and Arabic. The guide is also available digitally, so clients with smartphones can access the guide from their phone without having to remember to carry it with them. You can view it too if you want. Just go online and see for yourself. Products that are determined to be authorized foods, which meet USDA guidelines for the foods that WIC provides, are all listed in each state's digital database known as the APL, Approved Product List. In Tennessee, our APL has over 35,000 items and counting. Products are controlled by their UPC. This is another integrity aspect of WIC intended to assure that WIC funds are in fact used to purchase only WIC authorized foods. Next slide, please. This is our most favorite thing these days, because while the shopping guide is useful, the WIC Shopper app is the best thing since sliced bread. Many states offer a companion WIC shopping app. In Tennessee, we launched ours in early 2021. So we did start the pandemic without this. We had been on the card for a little while, getting people used to shopping and the different tools that they had to use to be able to keep up with what was left on their benefits, because you can go shopping for part of the food. You don't have to buy all of it at one time. Well, how do you keep track of that? Well, now you have the Shopper app to keep track of that. So this improved the shopping experience for many WIC clients who have taken us up on the advice of downloading the app to use when they shop. It also does other things for them too. Once the client's unique eWIC card information is added to the app, they see things that were before only available to them on paper printouts, which are obsolete the first time you go shopping, or by calling the card account administrator prior to each shopping trip. That relies too much on many steps. It's so much easier to just have the info in this app. So for clients comfortable with this technology, the Shopper app combined with other digital WIC services definitely have the potential to improve the WIC shopping experience for all these reasons listed here. Features of the app continue to expand and evolve as apps do. For WIC clients in Tennessee, this has been a real game changer. Next slide, please. So what do eligible clients need to know? Categorically, eligible persons or families should contact their local WIC office to request services. While WIC clinics have different ways of conducting their business, all offices are permitted to have up to 10 days to schedule initial enrollment appointments. So an initial applicant calling us, we are, and this is an item that we are watched closely for. And we, as I and any of my counterparts in the regions across the state, it is something that I watch very closely to assure that we have timely appointments for these new applicants. Various proofs are required to be presented for review to determine an applicant's eligibility. Clients who are enrolled in SNAP or Medicaid TennCare are automatically eligible for WIC. Some WIC offices will allow proofs to be submitted digitally. As stated earlier, these operational details are at the discretion of each WIC office. Next slide. So for Knox County, these are all the ways that you can contact us. Someone had asked earlier about, is there a number for someone who speaks Spanish? I didn't list it here, but actually, yes, we have a dedicated line for folks who speak Spanish. They can call. It's not, it prompts to leave a message, and we return calls to all messages every day. But we also have bilingual staff. More and more of the locations, you're going to run into bilingual staff who can at least assist with clients who speak Spanish. It's one of the reasons why we opened up our door. Our doors were shut for the majority of COVID, but I started to worry that some of the clients who really were more comfortable coming in to access us by coming in person, it would be easier for them if the door was open. So that door opened back in February, and it stays open anytime during business hours. And we have all these different ways to reach us because we recognize that one size does not fit all. So all these ways that people can reach us, you know, the doctors like to use the fax machine, but the people at Bridge like to send us an email. So it's whatever works for whoever the partner is. If it works for them, we got you covered. Next slide. So across the state, outside Knox County, to start with, the best starting place for finding any local WIC office's contact information is just to go to the State Department of Health website. You find the WIC page. It's very easy to get to all the WIC clinics. The contact information is updated by the state WIC central office. So they are aware of how important it is for this information to be available, not just for applicants, but for partners who are advocates for the clients who are challenged sometimes to navigate this stuff on their own. And if necessary, if you're just not getting what you're looking for, you know, easily, by all means, contact the state WIC office. Off the top of your head, it's 1-800-DIAL-WIC, but those are the numbers. If you have a hard time looking at the keypad, knowing what digit goes with what letter of the alphabet. So next slide. And then here in Knox, this is my contact information. Feel free to reach out to me with questions or concerns if you've got, you know, something you think I can help you with. Sarah Griswold, who is very involved with TJC, who's on vacation this week, which is why you got me rather than Sarah. But Sarah, when she is available, is always happy as well to help anything that she can do to contribute. All right, next slide. And that wraps my part up. And I will let the hosts decide if questions come now or later.
Well, we did have one question in the chat from Elmitria Turner. Is the $50 per month for WIC fresh produce / fruit? Is the $50 per month for WIC / fresh produce / fruit? I was told it wasn't income based. All pregnant, postpartum, birthing people can receive it. Is that true?
I'm not sure. Let's see if I can answer the question, that I don't exactly understand the question.
If you'd like to come off mute, you're welcome to.
Sure. Good afternoon, everyone. I'm a doula located here in Memphis, Tennessee. And one of my clients actually told me that she started receiving, I think, $50 per month in terms of, I'm not sure if it was WIC or fresh fruits and vegetables, and that she was told that anyone could qualify for it regardless of their income. And so I wasn't sure or aware, because she's not on Medicaid or anything like that. She has her own private insurance. So I didn't know if that was true or not.
If there's some other program that's operated in conjunction, you know, it might be limited to the Memphis area. That does not sound like anything that I want to speak to. It doesn't sound like what WIC, you know, if she's on WIC and she meets the guidelines for a prenatal or a postpartum woman, she would receive our cash value benefit for fruits and vegetables. But if there's something else being offered that's fresh, maybe it's a companion to what's going on at the farmers markets. Right now it's big farmers market season, and I didn't go into this, but we in Knox County have a farmers market nutrition program for our WIC clients as well, but that is not every county statewide. So I didn't go into that. I don't know what I don't believe Memphis participates in the farmers market program, but I could be wrong. So, you know, USDA likes to throw a lot of different programs out there, and I don't know if I want to speak to what might be another program.
So where do I need to direct that question?
But we'll connect with us. And at the very end of the slide, I'll share with you my email address, and we can just dig into the details. We have one more presenter, and so I wanted to save time for them, but we'll follow up with you on this specific question.
Thank you.
Thank you for the question. All right, thanks, Chris. And I know there are a couple other questions and hands raised, but if you could all hold your questions to the end. I want to introduce our next presenter, Estela Rios. She is one of our great partners from Memphis. She's the program director of Latino Memphis. And I want to turn it over to her to share a little bit about what they all do at Latino Memphis and how they're connected to the WIC program.
Alrighty, good afternoon, everyone. So I'm going to try to move through my slides pretty quickly to focus more on the WIC, so we can go ahead and get started. So Latino Memphis, all right. So I'm just going to present a little bit about Latino Memphis. This presentation we use as a yearly review of what we did last year, but it's our most comprehensive, so I'll be recycling it. Next slide. So our impact model consists of 3 aspects. We empower families and individuals through direct social and legal services. We impact systemic change through advocacy and engagement. And we're scaling impact through strategic and meaningful collaboration with government, companies, and nonprofit partners. Next slide. We do this work through 8 programmatic areas. El Centro, which is our Information and Resource Center. Derechos, which is our Immigrant Rights Defense Center. Justicia, which provides civil legal services to Derechos clients. Tu Voz, our Advocacy, Engagement, and Partnership Department. Senderos, which focuses on workforce development. Puentes consists of our caseworkers that support unaccompanied minors and victims of trafficking. Conectate, which offers digital literacy courses. And Tu Salud, which is my department and focus on community health and health equity. All right. So El Centro is our oldest and largest department. They focus on direct client services and point clients to in-house services and programs, as well as external agencies to meet the client's needs. Most of our clients are women between the ages of 30 and 50 with 2 to 3 children, an equivalent of a middle school education and little to no English skills. El Centro focuses a lot on SNAP application assistance, advocating for people who are having issues with WIC, as well as other administrative applications like applying for a replacement card for your Social Security card, renting utility assistance through community partners, and offering our space in our office to community partners so that Latino clients have access to these. Like we had partner days with the Shelby County School District, the Child Support Office, stuff like that. Derechos, so they offer to represent clients in immigration court when they are in removal proceedings, file affirmative applications with the U.S. Citizenship and Immigration Services. They represent these type of cases which are listed. Currently, they are focusing on special immigrant juvenile status cases, as well as DACA renewals, T visas, which is for victims of human trafficking. Next slide. Senderos, so that's our Latino Workforce Development Program. So they have 2 programs, next slide, which offer this service. So we have Digital Skills for Life. It's basic digital literacy offered in English and Spanish. Latinx at Work, which is more workforce development focused. That one you do have to have work authorization, but At the end of the program, you get a free tablet. And then finally, the Financial Empowerment Network, where clients are paired with a financial coach and they have sessions over the phone. No string, zero commitment, completely confidential and free. Next slide. These are just some of our graduates from last year. Last year, we were able to offer computers. This year, we have to offer tablets, but yeah, just some of our graduates. Next slide. Puentes, so I mentioned them earlier. So they offered post-release services for unaccompanied minor and support for victims of trafficking. And they connect clients to education, mental health screenings, therapy, medical care, and some legal services. Our caseworkers are based in Memphis and Nashville, and we're hoping to expand to Knoxville soon. They're our biggest department, actually. Next slide. All right, so Tu Voz en Tu Salud. So Tu Salud, which means your health, is a relatively new department. We just turned one this year, and my position is also relatively new. So Tu Salud came about from the COVID-19 pandemic. Previously, our work operated under Tu Voz. So we saw that the need went beyond, COVID-19, and we saw the need for a health-focused department, which is why we have Tu Salud now. We focused a lot on making sure clients had the resources they needed to get tested against COVID-19, to get vaccinated against COVID-19. And we focused a lot on that over the last 3 years. And moving forward, we just launched a community health worker program, Promotoras de Salud, and they will be focused on encouraging healthy lifestyles in immigrant and Latinx households. And this includes making sure that they know that they are eligible for WIC, that they might be eligible for SNAP, and helping them through that process, as well as workshops to encourage better nutrition choices and physical activity. So really excited about that. Next slide. All right, so just to touch more on WIC, so El Centro, which is our Welcome Center specialists at the office, and Promotoras will be doing most of the work around WIC. So we currently assist clients with submitting their documents via email or via fax here at Shelby County. We advocate on the client's behalf if they're unable to get through the Shelby County Health Department, which isn't unheard of. We had a WIC convening meeting that the Tennessee Justice Center and the Urban Child Institute hosted last week, and that was super helpful. And we learned that they only have 4 people who are able to take calls for the whole city, and I believe only 1 or 2 interpreters that also do work around the clinic. So our clients have a lot of difficulty getting through. And through this relationship that we have with the Tennessee Justice Center, we learned of other ways to try to make sure that clients have access to these appointments. So I would definitely encourage using the Tennessee Justice Center as a resource, because otherwise, before that, we really didn't know what we could potentially do to help clients access WIC. You can also email WIC to get an appointment and get them to call you back. But in terms of sustainability, I don't see how that works in the long run, because, for example, one of our case managers lifted up that, yes, I can help a client and email them and request an appointment, but what happens when they have to renew, or if they don't renew and they have to apply again? Like, I might not be there because their cases only open for about 3 months. So we're looking forward to more sustainable long-term solutions. I know the Shelby County is really focusing on this, and they're have a call center that are trying to establish in the near future. So we're very hopeful for that. But as it stands now, it's quite complicated for our clients to access WIC. And we're hoping for long-term sustainable solutions. And it was really nice to see what the Knox County is doing. So we're hoping that the Shelby County Health Department and within the WIC department can kind of model their future efforts to that, because you can't say you want to reach the Hispanic population, reach the Latino populations, when you don't have systems in place to serve them. And they may not always have an advocate like Latino Memphis. Lastly, we just have a few stats from our social media. And then next slide, we like to show off our staff, which is mostly Latina women. And that's all I have.
Estella, thank you so much for your presentation. And Lori, thank you as well. I realize that we are 1 minute after the hour. Again, we are recording this, so if folks have to get off the line and would like to tune into what you miss, we will send that along. We just have a few more slides to share, and we'll stick on for a little bit longer, just to talk through any questions folks have, if you have the time to stay on the line. But again, it's recorded. Real quickly, I had mentioned in the very beginning that Tennessee Justice Center, along with Latino Memphis, are part of the WIC Community Innovation and Outreach Project. Nationwide, there was an RFP put out about a year back to apply to focus on the WIC program and do concentrated work on outreach and partnership building, but then also digging into where some of the barriers are and better understanding why people are not connecting to the program. And so we're doing a bit of that with the WIC Chow project. And in addition to Latino Memphis, we're working closely with Vanderbilt Pediatrics. We're also working with the Tennessee Immigrant and Refugee Right Coalition. We are also focusing part of this on the grocery store experience, and the Tennessee Grocers Association is also one of our partners. So we have a strong group of partners across the state and beyond this as well. Some of you on the line have worked closely with us, and so we're looking forward to digging into this with the grant partners as well as community partners across the state. And the next slide just shares a little more details about the WIC Chow project in Tennessee. We're really working to increase awareness in participation. There were 36 projects awarded across the country, and Tennessee was one of them. Our focus is, like I said, increasing awareness about the WIC program. We are particularly looking at populations that are underserved. So we are looking to improve access for Black, Latino, immigrant, LEP communities, as well as ages 1 to 5, and strengthening the pediatric WIC referral process. Vanderbilt does some referrals and some screening amongst their patients to determine whether or not they might be eligible for WIC, and so we want to model that across the state. And again, we're working with the Grocers Association to look at that side of the program, because we can put in all this effort to sign people up for the program, but if they're not able to actually use their benefits, then there's not much use in that. So we really want to look at that aspect of the program as well. And so we'll be doing some surveys and focus groups in addition to the partnership work that we already do. And that just gives you a quick snapshot of this project. And I think those are the main highlights. I want to save a little bit of space for questions. And at the very end, I have my contact information, and Chris's contact information as well is there. And so if folks have any questions beyond today's conversation, or if we need to dig into anything, we'd love to do that. And I saw some folks in the chat. We have the WIC state director with us today, and she shared her information. So thank you for being on the line, and thank you for the links that were included there. Chris, you can move ahead to the oh yes. Back one more slide. One other thing that we are doing as a part of this grant project is we're meeting monthly with partners and WIC experts. We've had, I think one of the county WIC offices join us for one of our past calls, but it's an opportunity to find out, we'll lift up information that we know about WIC, but it's also an opportunity for us to learn from you all and to find out what your questions are and dig into any of those areas. So we invite you to join us for the WIC monthly champion group meetings that we're hosting. The next one is on August 10th. And then the next slide is a bunch of resources. There's a lot of great information out there about the WIC program. So we have some links that we'll send out to you all for some end of summer reading, and I'll stop now and move it over to the question slide, because I know there's a hand raised, and just want to touch base on any of those final questions.
Yeah, Dominic, do you want to come off mute and ask your question? And we had a question earlier from someone, Cat Bike, says, apologies if I somehow missed it, but was using WIC at farmers markets talked about? I know we discussed a little bit. Does anybody want to speak more on that?
I'll take that question. This is Lori. The farmers market is a separate program from WIC. That's why I did not go into it. WIC itself is available in every county across the state of Tennessee. But during farmers market season, there are a handful of WIC offices, ours is one of them, that participate in another USDA program, which is that there's farmers market nutrition program that's available to WIC moms and children. And then there's senior farmers market nutrition program. And we don't have that in our county, but we do have the FMNP program, and our WIC families who receive the farmers market vouchers, they get them if they want to. It's not a requirement, but for those who can get them, they get $30 worth of vouchers to use with participating farmers at the farmers markets during the months of July and August. That's how Tennessee operates the farmers market program in Tennessee. I would love for there to be more, but that is what there is right now. And I'm very happy that we have it available in Knox County, but it's a separate program from WIC.
Lori, do we have any other questions?
Chris, one other thing that I wanted to lift up that Lori mentioned, and something that TJC has been very focused on, is the CVB, the extended fruits and vegetable benefit that has been available because of COVID. And Lori had also mentioned that this continues to exist because Congress has voted to approve the funding for it. We think this is a very important addition to the program that came about because of the pandemic. The additional dollars dedicated to fruit and vegetables has been very helpful to families, and we don't think it should go away. We want it to stay in place. And right now there's the House bill. The current House bill is looking at cutting that benefit. So I know not everybody on the line and not all the partners in our orbit can do advocacy, but if you can, I highly recommend now is the time to let Congress know if any of the families that you work with have benefited from this, if you can lift up how important it is to have that extra money to pay for fruit and vegetables, now is the time to do it. And we can put a link in the follow-up to share more information about that. But that is going to go away at the end of September unless Congress approves that benefit to continue. So I just wanted to lift that up from Lori's presentation and let folks know about it.
Awesome. And again, Dominic, if you're still on the line, you're welcome to go ahead with your question. Otherwise, we'll, Courtney, do we have a question?
Hi, yes. I work at a food bank in Maryville in East Tennessee. And I actually work pretty closely with Sarah Griswold, or I have in the past. And so I'm familiar with her. But I wanted to know, as somebody who works with the charitable food system, how can we support WIC through this? Because we have given out like flyers and things like that I've received from Sarah before, but is there anything else that we can really do?
Thank you, Courtney, for that question. Yeah, I think all partners who are connected to families who might be eligible for this, I don't know if you all do any sort of SNAP application assistance, but if you do that and you're able to identify families who might be eligible for WIC, being able to refer them, I think is important. You mentioned putting flyers into food boxes or food packets that you deliver. I think that's a great great way to share information. And we have a couple other food bank partners who have joined us for those monthly WIC champions calls. So I'd recommend and welcome you to join us for those as well, because we're talking about these issues and how to better connect families. If ever you go out into the community, and I know you do because you're the food bank, and do resource fairs and things like that, sharing information about WIC is a good way to lift it up. And I know you're often connected to other network food pantries and kitchens as well. So if there's anything that we can do to share information to other people in your network of food banks and pantries, we're happy to share that information. Because sometimes the partners don't have the information, they can't share it. So we're happy to push out more information if that's helpful.
Can I throw in an idea as well? Because I think that we often always think, yes, let's tell them about WIC, let's tell them about WIC, but it's hard for the families to circle back to that. And I think an effort that sometimes is incredibly useful for families is for the referral to come to us somehow from the partner. So if I get a name and a phone number of a client who wants us to call them, we will call them and get it, and we will take it over for you. But we will also help them not have to navigate reaching us. So if there's a way that this process can turn into the partner and the WIC office communicating so that the clients know we're doing it on their behalf. Yes, I've got to set it up for the client, but don't put them in the position of also having to be the ones to navigate reaching us. We can do better.
That's awesome, because we do the SNAP assistance here, and we have somebody on staff at our food bank who does help people sign up for SNAP. And so yeah, definitely, like, breaking any of those barriers is really helpful. So that's great. Thank you, Lori.
Yeah. That's one of the reasons why our email is such a popular option. We've got partners who will literally just shoot us an email with a client name and a contact number, a little bit about, what's their deal. And then we take it from there.
Great. Thank you.
Thank you, Lori.
You're welcome.
And thank you, Courtney, for the question.
All right, do we have any more questions?
All right. Seeing none, I will say this is an opportunity beyond now. If you still have questions once we end today's presentation, please feel free to reach out to us. We want to keep the conversation going and look forward to working with you all on connecting more families to WIC. So thanks for joining us today.